Hi there, I'm Arthur Cummings and I'm with my son Brendan Cummings. It's a privilege to be on this call with him. And we're going to be speaking about UBM with AI on top of it and a product called ISIL Guru. And how we've integrated that into our practice recently and the differences that it's brought about. Brendan.
I think something that'll be very interesting to go through is you've used ICL for a long time. How has using UBM and AI and the ICL Guru changed the way that we do sizing? How do they compare?
Oh, it's chalk and cheese. It's very interesting. It's always painful to think about what we did early on. But early on, all we really had was the guidelines from the company. We never had any huge problems, but we always did a case and you were wondering what you're going to get. You had no idea what you're going to get. The low volt, the high volt, small angles. There was always this question of, I don't know what I'm going to get. And then in 2014, when the Aquaport came out, that made it more forgiving. So the stress came down a little. And then we started using a formula called the NK, the Nakajima formula with OCT about 8 or 9 years ago. And that certainly improved things. It gave us more confidence. And again, not doing badly, but still getting surprises, low volts or very high volts. And I'm more concerned about the angles and the volts really, but angles that again, where, wow, should I exchange this lens or should I not exchange the lens? As well as I do, because you went to the course with Sonomed and the Zoldival course and came back saying we need you to get ISIL Guru. And you've seen yourself what's happening in the practice. We have doubled volume year on year almost, just thanks to the fact that we are so confident now in the results we're getting. The fact that it's so predictable it's just a different ball game. So you can almost imagine if you were doing LASIK now for the first time and you had no idea how thick the flap was going to be. That's how we started out with LASIK too. And now it's more predictable. So it's much the same sort of analogy that it's just more predictable. In so many ways, I envy someone like yourself whose first experience with ICL is with ICL Guru. That's the way to start.
I completely agree. I always think people in my generation think that the surgeons, the kind of refractive surgery trailblazers were so brave. You doing so much things without really knowing exactly how it's going to turn out in terms of flap thickness and bulk. When I came back from the ICL Guru course in Argentina, you remember I said I don't want to do an ICL until we're using ICL Guru, because when you're starting out as a surgeon, you want to limit your experience to all positive cases. You don't want to have to deal with a surprise early on in your career. And that's all I've ever known.
And you're 100% right. You want to start off well, but the truth is no matter what stage of your career you're at, you don't want bad cases. And I think this is exactly what ISIL Guru does for you, is it cuts out those surprises. There are no more surprises. I'm sure later on in this conversation, you and I will speak about the outcomes we've got, and the outliers just don't exist anymore.
It's been incredible how predictable the volts have been. We've not had one case where we've had to exchange the ICL or even think about it too much. If we did have a higher volt early on, by 1 week, things had settled to where the ICL should be sitting.
You'd wonder why the numbers have doubled in the space of a year. And the thing is nothing more than our confidence. We're not trying to convince people of anything. Now, because your confidence is so high, I'm happy to speak about ICL at -3 and -2 and -4, where in the past, if LASIK could do it safely, it was the LASIK, because you had this concern about sizing. The only concern you've ever had really is about sizing. And in years gone by, the only time you'd think of ICL would be when you're not suitable for LASIK. When now, as every patient comes in, knowing we don't know what they're suitable for until we've done the entire examination. And then once we know all they're suitable for, we then make the best decision for them based on their needs and whatnot, and their anatomy and their physiology.
It's part of every conversation that I have with the patient nowadays. If you think about it, doing UBM makes so much sense compared to other sizing methodologies, because we'd always use proxies to estimate where the sulcus to sulcus space is going to be. And as there's all this variation anatomically, not everyone has the same relationship between their angle to angle as their sulcus. And well, OCT helped to exclude more outliers. Actually measuring where the lens is going to be is the way to really exclude them as much as possible, to reduce it to the lowest number you can possibly get. And the beautiful thing about ICL Guru is the more that we feed it, the more post-op data we give it, the better it's going to become and the more refined it'll get. And the numbers are only going to improve in terms of accuracy.
Absolutely. The other thing is, I never once diagnosed an iris cyst before with a UBM. So you just wouldn't even know if there's a cyst that you're going to take.
It's like maybe 10% of cases we see a small one.
Exactly.
I remember very well when I went to the course, I remember I had wrote down in my diary a few things you wanted me to learn from it. And the main one was, what UBM are they using? You really wanted me to find out what UBM are the Zaldivars using. And when I got there and I saw how the Zaldivars had worked with ICL Guru and with Sonomed, it made all the sense in the world why Sonomed was the only UBM to get. The fact that it's betting the images for us is incredibly powerful. We know that the data that's used to feed the ICL Guru algorithm is really high quality, and it's a really well-aligned scan at the right depth with the right focus. Can you imagine trying to introduce this type of technology where you don't know if the quality of a scan is good enough to feed the AI?
Absolutely. You know the phrase, giga, garbage in, garbage out. You have to give great data. So you're getting that from the device, but then the device is selecting the best images. And it goes through this incredible algorithm. And I think right at the end, when the sizing is actually applied, there's also mathematics applied to the potential forces on ISIL itself. We've never had a tool like this, never before.